Welcome once again to In Depth, where we focus on issues by separating the news from the noise in these corona times. Remember, coronavirus continues to wreak havoc across the world. In India in particular, as the caseload has increased, it's India's major metros that have taken the biggest hit. Mumbai continues to be the worst affected. Delhi is number 2. It's reported more cases than even Mumbai in recent days. And the three metropolitan cities, Mumbai, Delhi and Chennai, between them account for the maximum share of the country's caseload. Today we are going to focus on another metro though, Bengaluru, which has done remarkably well in comparison to these three. Is there a lesson from Bengaluru that can be learned? But before that, let's take a look at the overall picture, why coronavirus has remained largely focused on India's major metro cities. Take a look.
The national capital, financial capital, and the city of temples. All metropolitan cities buzzing with energy. But today, when coronavirus is wreaking havoc across the world, these three cities in India together account for almost 40% of all Covid-19 cases reported across the country so far. Over the last 2 weeks, these three most affected cities have begun to converge in terms of new cases discovered every day. While Mumbai still remains the worst hit, having more cases and deaths than the other two put together, Chennai's new cases are growing fast and beginning to show signs of outstripping Delhi, which has twice as many people. On June 3rd, Chennai saw its biggest single-day spike, recording 1,012 new cases. Out of a total of 208 COVID deaths in the state of Tamil Nadu, 158 are from Chennai. In West Bengal, Kolkata accounts for 2,394 cases out of the state's total of 6,508. And in Gujarat, Ahmedabad reported 290 new cases on Wednesday, taking the total in the city to 13,063. But with the caseload in India's three worst affected cities increasing by the day, Mumbai, Delhi and Chennai are now inching towards New York City, Sao Paulo and Moscow as the worst affected cities of the world in terms of new cases each day.
So as you can see, there are two cities in particular, Mumbai and Delhi, which are in the crosshairs of this battle against corona. Now, while all the other metros are also fighting their own battles, Bengaluru has been rather lucky. The city so far has around 417 cases, which compared to the other cities is really a standout. What has Bengaluru done right? What is it about the Bengaluru model of fighting corona? That's our special report. Take a look.
The IT capital of India has people from across the nation and the world settled here. But with a population of approximately 1.2 crores, that's 12 million, the city had only 417 cases as of June the 3rd. This figure is way less than what cities like Delhi, Mumbai and Chennai report in a single day. Out of the 417 cases, there are 149 active cases. 256 have been discharged according to information given by the Department of Health and Family Welfare Services, Government of Karnataka. So what is the model that Bengaluru has followed?
We are the first city to close down city, malls, everything before a week, before the central analyzed to close it.
The much touted model has 6 main elements to it. 1. The bureaucracy does not overrule expert advice. 2. Exhaustive tracking of all contacts of patients. 3. Conducting door-to-door surveys. 4. Using technology to cut through red tape. 5. Identifying clusters early and isolating them. And 6. identification and testing of high-risk patients.
We did our best to contain and plan, and we took the assistance of all the experts, medical experts, and all possible experts, ideas, thoughts, everything was collected, and we came into a plan of action.
It is said to be the strict implementation of tracing, tracking, testing and treating that continues to make a difference in the city. Towards the end of March, India Today had visited the command center that had been set up by the city's administration. So even as the lockdown was being announced, Bengaluru had a control room going.
Now, in order to control and fight the coronavirus or COVID-19, a war room, command and control room, virtual training center has been set up right here in the Bruhat Bengaluru Mahanagara Palike, or the BBMP. Now, this was set up in quick time in order to help the government, especially control the situation in Bengaluru. Now, we are actually entering this war room. A lot of work is actually going on over here. A lot of experts from the health department and all the other departments. The idea is, with better coordination, things can work seamlessly.
So for all practical purposes, it was more than 2 months ago that Bengaluru began operating a 24/7 strategic center with a team of at least 10 people working in shifts to monitor cases.
What essentially we do here is breaking the clutter between the departments. The information will flow in from the top to down in a seamless way. So ideally, we have set up a center here with 3 main features. One is like command and control room. So we would analyze the local data that is tabulated using a GIS mapping and all. And then we also mark a GPS marking for some of the facility identifications. And the third most important part is the virtual training center. So the virtual training center essentially trains the respective on-field officers, or it might be health workers, or it is for internal dissemination of technology as per the WHO guidelines.
It was on March 8th when Bengaluru had reported its first COVID-19 case. The BBMP says they then prepared a list of 2,666 people who had come in touch with the 40-year-old techie who had come back from the US. For over a month, these primary and secondary contacts were sent into home quarantine and were monitored for symptoms. If the numbers in Bengaluru remain under control and are verified, then the city of 12 million population surely needs to be commended for having beaten the pandemic. And the secret, says those in charge, lies in the planning, coordination and reliance on expert advice that went into how Bengaluru tackled COVID-19.
So is there a Bengaluru model that could be adapted and adopted by other major metros? I'm joined by Dr. Devi Shetty, Chairman Narayan Ridilai, and a proud Bengalurian himself. Appreciate your joining us. Dr. Shetty, give us a sense. Is there something about Bangalore that has meant that it has been less that you've managed to contain corona spread as compared to a Mumbai or a Delhi? Or is it very unfair to compare one city from the other, given the different demographic compositions?
We all started at the same starting point, but Karnataka government has done a phenomenal job in coordinating every activity at every level, starting from Bangalore to not only Bangalore, even districts, by the most proactive steps. And because of that, the stringent lockdown which was implemented in Karnataka states, there are 2 types of cities today. One type was a city where during lockdown you could do wedding shopping. Another type of city is the one where during lockdown you couldn't do wedding shopping. And the cities where you couldn't do the wedding shopping are the ones who are today celebrating. And Bangalore is definitely at the lead. And not only this, I can tell you 3 months from now, when you do the analysis of which state has done well, I can tell you Karnataka will do the best, because today Karnataka is doing 15 to 16,000 tests. Karnataka created 60 laboratories to screen the patients. Now we are all talking about what, you see, in the end, state should be judged not by the number of positive patients, but by the number of deaths. Believe me, Karnataka will prove to the rest of the country that we will have the best track record, because they are already putting all the necessary infrastructure to reduce the mortality, morbidity in case the number increases.
So you're saying there is no Bengaluru model. Bengaluru has benefited by being part of Karnataka, which broadly seems to have got its COVID fight right. But there, cities have been more vulnerable, more prone to COVID-19, at least in this first phase. Look at Mumbai, look at Delhi, look at Chennai. In that sense, what separates Bengaluru again? Was it that there was tracing and testing at an early stage, or did Bengaluru simply luck out?
No, it is definitely not due to luck. Bangalore was the first city in the country to announce a separate COVID hospital. They virtually emptied a busy government hospital with over 1,000 beds, kept it empty till the patient came. So because of that, the COVID and non-COVID patients are not mixed. Whereas most other city hospitals, they mix the COVID and non-COVID patients, compounding the problem. And Bangalore created the protocol for defining the zones, isolating, very, very aggressive tracking. So essentially, Bangalore has done everything what they're supposed to do at least 2 weeks, 3 weeks ahead of other states. Every state has done, every city has done. Bangalore has done much ahead of them.
Because health infrastructure also is under strain in a Mumbai, health infrastructure is under strain in a Delhi. Chennai has a very strong private health infrastructure as well. So does Bangalore. Did that help? Was there a strong private-public partnership in Bangalore?
See, we were all told to be on standby, but thanks to the government hospitals, we were never sent a single patient to a private hospital for the care. So they managed everything. But believe me, even if the number of cases increase, Karnataka state, Bangalore will never face the same problem like other states, mainly because we have nearly 40 medical college hospitals which are extremely well equipped with over 800,000 beds, and there are large private hospitals as well as a standby. So this state is definitely most prepared to face any consequences of the increasing number because of the people from other neighboring states coming to our state.
But, Dr. Shetty, on the other hand, in the last few days, the number of cases across Karnataka are increasing, particularly as the state opens up. Is that a danger that Bangalore, which is an open society to the extent that large numbers of people today come into Bangalore looking for work, it is a commercial city now, no longer the pensioners' paradise that's long gone. To that extent, does Bangalore have to worry in the next couple of months as the city opens up? You will face an increasing number of cases.
We will definitely face increasing number of cases, but you look at the number of tests what is done in Bangalore and Karnataka state, it is doing the highest number of tests in the country. So even though number increases because we are doing more number of tests, the moment somebody is found positive, their quarantine, contacts are traced, and very efficiently the whole cycle is managed. So the important thing is, some states are trying to hide the numbers. You can hide the positive cases, but you can never hide the dead bodies. So Karnataka state realized it in the very beginning. That is the reason why we are very open, very liberal in performing as many tests as possible. And in the process, you will see in the media, large number of cases are proven to be positive, but then they're all taken care of. They're not let loose to spread the disease to the other people.
So you're telling me that the Karnataka numbers are real numbers. These are not numbers which at any level, or the Bengaluru numbers are real numbers. No attempt being made in any form to fudge the numbers. Am I correct?
No. Yes, you're right. You're absolutely right. Yes.
Okay. Dr. Shetty, your smile says it all. For now, at least, Karnataka and indeed Bengaluru has much to smile about. But we'll have to wait and see whether Karnataka and Bengaluru eventually pass the test. For now, clearly, not just Kerala, but Karnataka also seems to have built an effective model to take on COVID-19. Thanks very much, Dr. Devi Shetty there, for joining me from Bengaluru. Let's take a break. When we come back, as Bangalore opens up. Welcome back. You're watching In Depth here on India Today. Now, Bengaluru has successfully limited coronavirus cases in its city limits. That's been our focus. It's shown the way in a way to other Indian metro cities. Now, with the union government giving a green light to religious places and malls to reopen next Monday, let's take a look at how Karnataka is planning to open up, and indeed how Bengaluru's temples are gearing up.
After almost 2 months, this oldest temple in Bengaluru is getting set to throw open its doors to devotees. The 400-year-old Kadu Maleshwara temple used to see close to 3,000 devotees every day. Now the temple administration says it will have to limit numbers. In these times of a pandemic, the temple will have stickers on tiles to ensure distancing.
Post-lockdown, there are a lot of changes we are planning to have in the temple, keeping the health and protection of the devotees. The temple has around 4 entries. We will close all the 3 entries and one main entry will be opening.
Tell us what will happen once the devotee comes here. Will you give them sanitizer here?
Absolutely. We'll keep a automatic sanitizing machine over here. Along with that, we'll check the temperature. Only devotees wearing masks will be allowed inside the temple.
Out of 4 temple entry points, 3 will be shut. Devotees will have to wear masks as well.
On every Monday, we have at least 3,000 to 5,000 devotees visiting the temple. But this being the lockdown period, so we'll be having a big control on the devotees. And we are making, to maintain social distancing, we are planning to have stickers put on the floor of the floor over here, so that only about 20 to 25 devotees can stand with good distance between each other, about 1 meter distance between each other.
But what about the prasadam? How will the temple offering be distributed?
Tirtham and prasadam is part of our Hindu culture, and the devotees who come want tirtham and prasadam from the temple. But this will be the most difficult thing to take a call, because tirtham and prasadam, every time when the pujari gives tirtham and prasadam, he'll be consuming right there.
No huge crowds, no congregations, no touching of idols. A temple visit just won't be the same anymore. Bureau Report, India Today.
That's it on this in-depth special. Thanks for watching. Maybe we now need to say what Bengaluru thinks today, the other metros need to think tomorrow. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.